All right, thanks for being here. Been waiting for this conversation for a while. The health care bill moving through the Senate, everyone seems to be talking about what the holdup is. Can the Senate get something done? They've extended the time before the recess to the second week of August instead of leaving right at the beginning of August. So what we've done is we have asked both Senators Flake and Senator Ted Cruz to join us. It's called the Cruz Amendment. Gentlemen, thank you for coming on the show this morning.
Thanks for having us on.
Good morning. Good to be with you.
Senator Cruz, let's start with you. The amendment that you're putting forth that seems to be getting some traction, what is it? Explain what the difference is now with this amendment in place or what it will be.
So the amendment is the Consumer Freedom Amendment, and what it is focused on front and center is lowering premiums. The biggest reason so many millions of people are unhappy with Obamacare is that it's caused people's premiums to skyrocket so that they can't afford health insurance. And what the amendment provides is that you, the consumer, should have the freedom to purchase the health insurance you want, not what the federal government says you have to buy, but what you want and your family needs. And so specifically, it provides that if insurers offer plans in a state that are consistent with the Title I mandates, they can also offer any other plans consumers decide. So it adds new choices for you, the consumer, and what that's intended to result in is substantially lower cost premiums to make health insurance more affordable.
So when one of the comparisons I've tried to make, I'm sure many others have too, is like with automobile insurance. You can have everything from the minimum coverage that you need to have to be legal all the way up to full coverage and raise the liability limits, which cost you more money, but those are the premium plans that people want. So it's similar to that.
That's exactly right. That's a very good analogy, so that if someone wants full comprehensive coverage of everything, that they can get that. That'll be available and they can pay for it. But some other people may decide that they want a skinnier plan, that maybe it's just a catastrophic plan. Maybe it covers, if God forbid you get some horrible disease, you're diagnosed with cancer, you get hit by a truck. They want coverage in a catastrophic scenario, but for a more routine health care issue, if you get the flu, if you break your arm, they want to cover that out of savings or a health savings account and not have that under insurance. That should be an option that you can choose, and you should choose whatever's best for you and your family.
Well, Senator Flake, you the table that you put up on your website, you shared with me a while ago about how the premiums in Arizona, the average family that are on the exchanges in Arizona, a family of four pays more on average for their health insurance premiums under the exchanges than they do for their mortgage. When you saw this amendment, you were very outspoken in saying that you really liked it. How will this affect the people in Arizona from what you've seen?
Well, first, let me thank Ted for being on this show and also for offering the amendment. What it will do is allow people who currently don't have insurance to get insurance. We have in Arizona, the latest figures are 183,000 Arizonans are paying the fine because they simply can't find affordable coverage. They're paying the total of $36 million in fines, and that buys them no coverage because they can't find affordable coverage. 85% of those who are doing that are making less than $50,000 a year. And just to give you one example, I have a friend who lives in Maricopa County who pays $1,500 a month in premiums for he and his family. He's one of the lucky ones who can afford it. But here's what he gets out of that: $1,500 a month. And when he pays his family deductibles, he has to get to nearly $40,000 a year in payments between premiums and deductibles before the first insurance dollar kicks in. That's not real insurance. And those are the kind of people that we need to help with this amendment.
Yeah, and I've asked that question quite often when people go to your office like they've been doing and they start saying, save our health care. I always want to know why someone doesn't ask them, what health insurance are you talking about? You don't have it. You have a catastrophic plan that's costing you, that's bankrupting your family. So is this amendment enough for you to say you're on board with voting yes on the health care bill as it stands?
Well, we're going to be going into a meeting just momentarily, Ted and I, to see what's in the bill and see what version of this amendment, if any version, is in the bill. Maybe Ted has more information on that. But let me just say, there is a lot of concern in Arizona on the Medicaid side. Nearly 1 in 3 Arizonans is covered by our version of Medicaid called Access. This amendment does not affect the Medicaid side at all. That's a separate discussion that we're going to continue to have in terms of how we make that sustainable for the long term. But the Cruz Amendment, the Consumer Freedom Amendment, does not affect the Medicaid side at all. So, Ted, you want to comment?
Well, that's right. We're getting ready this morning to see the full text of the revised bill, and I'm sure Jeff wants to review the full text. I want to review the full text. I have not seen the full revised text, and so I want to assess the bill. But the bill that will be released this morning, the revised text will include the Consumer Freedom Amendment, and so that is a very positive development. That's something that we've been working for many months to bring about, and I've been grateful for Jeff's help and support in advancing the Consumer Freedom Amendment, and I'm very encouraged that the bill being released today includes that amendment.
Okay, so asking both of you, and I'll start with you, Senator Cruz, the same question. If you were the one with the magic wand, what would you like to see happen? What would it be that would make this acceptable to you if it was your bill to get into the hands of the American people and you could get this something passed through the Senate? What would it look like?
Well, from the beginning, my central focus has been really on two things. Number one, that we have to honor our commitment to the voters to repeal Obamacare. For 7 years, Republicans have campaigned promising to get rid of this disastrous law. We got to get this done. Number two, the central focus, I believe, should be on lowering premiums, making health insurance more affordable for families who are struggling. And I'm encouraged this bill that's being released today has two different provisions that are targeted directly at lowering premiums. The first is the Consumer Freedom Amendment that allows you, the consumer, to purchase the health insurance you want, not what the federal government forces you to purchase. And the second is a provision that allows health savings accounts to be spent to pay for insurance premiums. That's illegal right now. And the advantage of that is that means you can use pre-tax dollars, which for many taxpayers means that's an immediate 20 to 30% decrease in their effective premium rates. Both of those are big deals. Both of those are amendments that I introduced that are reflected in the bill. And so that, I think we're making serious progress towards coming together and unifying our conference and getting a bill that can command the support of at least 50 senators and pass into law.
Senator Flake?
Well, the two things that I've said always have to be in the bill. One, we can't pull the rug out from under people who currently have insurance. That's what Obamacare did to too many people in Arizona. They had coverage. They lost their coverage despite the promises that you can keep your doctor in your plan. And second, we have to have something that is fiscally sustainable for the long term. And so that's the way that I'll judge this legislation, and hopefully we'll get a good result today, and I'm pleased that the Consumer Freedom Amendment looks to be included in the bill right now.
Yeah, it does. It seems to be the most positive thing we've seen in the Senate so far. Let me then ask one last question to both of you gentlemen. I'll start this time with you, Senator Flake. Are both of you confident that something can be done that will be acceptable to both of you and all the American people, that will be passed before we get out of this and go into this recess in August? Are you confident something's going to get done in the Senate?
We desperately need to reform Obamacare and repeal, as we said we do, but replace it with something that lowers premiums. We'll see if it can be done. That's the hope. Today's meeting is important in that regard.
Senator Cruz?
You know, I would say I'm hopeful. I believe we can get to yes. I think there is an agreement, and I think we're making real progress in that direction. I think failing to get this done would be really catastrophic, and I don't think any of the Republican senators want to see failure come out of this. So my hope is that we will keep working to come together, and if we're lowering premiums, that's a win for everyone. It's a win for senators across the ideological spectrum. It's a win for the men and women who elected us, and so that's really what my focus has been, and I'm certainly grateful for Jeff's support of consumer freedom, which I think is a big deal for lowering premiums.
Well, Senator Cruz, I want to thank you for coming on and talking about this amendment and for bringing it forward. And as always, Senator Flake, we're always grateful for your time with us when you come on our show as well. So thanks, both of you.
Very good, Mike. Appreciate it.
Thank you.